Thank you so much, Lalit sir.
Yeah.
Thank you, Novartis, and nice to see all my senior colleagues here. So I'll start my screen share. Acha, that was a webcon event. I was surprised where did the audio come from. Oh. So I hope my screen is visible. Thank you so much. We can set the timer. So this is the disclaimer. I have no financial interest disclosures in this presentation. So we all know that according to this study, more than 5.1 injections are actually required to maintain the baseline, and more than 7.9 injections are actually required to improve the vision from the baseline to more than 15 letters, according to the study done by Halls. So if we see the ranibizumab, it is 0.66 letter gain per ranibizumab injection. So how many injections we need to get into to reach from 0.66 letter to 15? So that is why there is a need for long-term injection. That is the injection of longer durability. So here we have various injections. We all know about aflibercept, ranibizumab, bevacizumab, brolizumab. So what makes brolizumab interesting is about this molarity. It has relative number of injections, molecules per injection is 11.2, 13.3 as compared to the aflibercept, which is 1.0. So theoretically, it makes brolizumab more potent. So come to the case. This is a 27-year-old woman presented to us on August 2020 with blurring of vision in the left eye. She received multiple anti-VEGF injections elsewhere, and her vision was 660 and 18 on the day of presentation. So this is the OCT of the left eye. We can see there is subretinal fluid, there is a PED, there is a pachychoroid also in this, and if you see the OCTA, there is a neovascular network in this case. So the diagnosis of left eye pachychoroid neovasculopathy was done. Intravitreal ranibizumab was given in the first instance, but 1 month, 4 days, there was in fact increase in the intraretinal fluid, leave alone the settling of the subretinal fluid. So we switched to aflibercept. You can see there is a good response to aflibercept 1 month, 15 days post injections. But there was recurrence on this, and then 2 months post aflibercept, there was recurrence. And she was advised repeat aflibercept injection, but because of the financial issues, she used brolizumab, and brolizumab was given. And even after 2 months, there was still maintaining good vision and anatomically also doing better. So this is a 71-year-old man who presented to us with blurring of vision, diagnosed with right eye CNVM, and the second opinion was taken. He had come here for second opinion. And here you can see these are the polyps actually very nicely picked up by the OCT. And here you can also see the OCT network, that is the avascular area. FFA ICG definitely showed the polyps, and this is the FFA corresponding to this polyp. And this is the another polyp which is getting corresponded here. So started on aflibercept 3 monthly doses, PRN followed multiple doses. You can see here from 2017, she is on multiple injections. So these are the few glimpses of various injections she received per year. And the OCTA, when we did it, it appeared to be a dead tree appearance on type 1 CNVM on OCTA. And but unfortunately, she stopped responding to aflibercept. And here you can see here, there was no much response at all 2 months post aflibercept. That is when we switched from brolizumab, and we can still see this is just 1 month 14 days, but she had come very recently. It was almost around 2.5 months, and she was doing pretty good. So and another interesting thing what I find here is the FIPED, the height of the FIPED has also decreased. So when we are doing a comparative analysis of the height of the RP, the FIPED in these cases as compared to aflibercept, we see that there is a stronger resolution of the sub-RP fluid as compared to the aflibercept. Of course, head-on trial is needed to justify any of the statements which I said. So 3.5 months, again, she developed recurrence. So according to us, she tolerated this injection roughly around 3 months to 3 months and 1 week. And again, after 3 months, we gave a repeat brolizumab, and the follow-up is awaited. This is another case where you can see the tall peak PED with a notched PED here. And this was again a case of PCV, corresponding point of sign of polyp on octa here, you can see here. And FA and ICG was done. It also showed a polyp. She was advised aflibercept before, but because of financial reason, she opted for brolizumab. There's another good thing about brolizumab is they have come out with a cost-effective rate as compared to the aflibercept. And this you can see 1 month post-injection, she is really doing well. So another case, this is the interesting case because she had multiple injections right from 2014. And here you can see the multi-layered PED with type 1 CNVM. You can see the octa also showing a neovascular network, and she received brolucizumab. So she was a very curious writer and a reader. She is only with one eye, other eye is totally scarred. So when I injected brolucizumab in her, she was one of the few patients who told me that the visual acuity improvement was pretty early as compared to the earlier injection. I don't know whether it was psychologically she was saying because I said her it's a new injection, but she was pretty much sure that she had early visual recovery as compared to aflibercept, which usually used to take 2 weeks or 3 weeks in time. But anatomically also she developed pretty well, and visually she was definitely very happy. Again, in this patient, you can see it tolerated to nearly around 3 months in this case. And again, when the recurrence started, we gave her repeat injection after 3 months. So this is again after 3 months, the follow-up is awaited. This is just before the 3-month injection. So another case here, you can see there is a case of the left eye, the right eye showed PEDs with the SRF, and we did FFA and ICG in this case. And again, it showed the branching vascular network here. You can see here, this was the case of BVN recorded on ICGA, and corresponding site of sub-RP network and the FIPED on OCT and OCTA was shown here. This is the another picture where you can see and she received multiple mixture of ranibizumab, bevacizumab, brolucizumab. But after brolucizumab, because this is on the day, and she had a very good recovery because she had stopped responding to ranibizumab. And this complete resolution, now you can see 2 months and she was still holding. So this is another last two of my cases, right eye OCT. This is the left eye OCT that showed FIPED with SHREM here with SRF and IRF. The FFA and ICG confirmed that there was a signs of polyp in the late frames, and this was corresponding the FFA to the OCT here, that is the polyp on the OCT and the FFA. This is the left eye which also showed, and this is the case who received multiple injections of aflibercept. Again, you can see here on the day of brolucizumab, last follow-up 3 months. So this patient roughly came up to between 2 to 3 months, and this was again followed up, and we again re-injected after 3 months of follow-up. So I'll skip this last case of mine. This is another patient who was a sister of the fourth case which I shown. She underwent again multiple surgeries, and this was the injection she received. And lastly, we had to shift her. This is the retained PFO she had because of the surgery, myopic eye. And now you can see 1 month post brolucizumab, she has around 6/36 vision in this eye. 1 month post brolucizumab, she is doing good. And 2 months, again, you can see here, there was pretty much a good improvement. But post 2 months follow-up, again, she developed signs of recurrence. So this patient tolerated for nearly 2 months, but not 3 months. On right eye OCTA, almost my last slide. When we did the right eye OCTA, you can see the hyalinized trunk here, along with the peripheral small caliber vessel network, which shows the signs of chronicity. And fortunately, in the right eye, also she developed CNVM, but she's doing good. 1 month post brolucizumab. She had come recently, and she's post 3 months, and she's pretty much doing well in the right eye. And her vision in the right eye is 6/18. So with this, I conclude telling that in our initial case of 40-50 cases, I have seen excellent response with brolucizumab in occult CNVM, PCV, and chronic non-resolving SRF and IRF. So the maximum duration of action noted at our institute was around 3 months. So I'd like to acknowledge our fellows, Dr. Farhat and Dr. Rajeshri, for picking up these cases for me. Thank you very much for the patient listening.